We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and globally on the iHeartRadio app and the WWNN radio app. Welcome to Doctors Are People Too. We're here on 1470 AM and now on 95.3 FM. I got it right. I actually listened to it on the way up, and it sounded awesome in my truck. So really glad to be on 95.3 FM as well. And also WWNNradio.com. But I'm more excited than anything to have Dr. Gary Richmond on the program because we're going to talk a lot about pain medicine management and also a little bit about anesthesiology. And I've had this show since May, but I haven't really got into those medical specialties, and it's something that I've wanted to have on for a while. So, Dr. Richmond, welcome to Doctors Are People Too. How are you doing?
Thank you. I'm doing great.
Great, and it's great to have you.
Thanks for having me.
I appreciate it. So we can go on this adventure of health. So let's get right into it. Your areas of expertise is interventional pain management, and I've heard that word interventional come into medicine the last few years myself, but I know it's been in medicine for a while, but I'm just talking as the common man because interventional cardiology, interventional neurology. And
sure.
I think we talked a little bit about, I was going to say it was the catheter-based treatment because I'm thinking about interventional cardiology, but why don't you explain to our listeners a little bit about interventional pain management and how you use it for pain medicine?
Sure. So interventional pain medicine basically is trying to identify the source of pain. Now, I practice at the Orthopedic Center of Palm Beach County. A lot of what I do in my practice is treating neck and back pain. Pain is a symptom. It's not the primary source of the problem, but that's what you feel when you have another problem going on. So with interventional pain, we try to identify the source of the pain. Oftentimes we're doing injections, whether it's cortisone injections, local anesthetics, other types of treatments to try to treat the source of the problem so that pain, muscle spasms, and other symptoms that come and are triggered by the source of the pain decrease and the patients are more comfortable, as opposed to writing narcotic pain prescriptions and saying, oh, you've got pain, so let's mask it with pills.
Which can cause an array of problems down the line.
All kinds of problems.
I mean, we saw that here in Palm Beach County and elsewhere.
Yes.
Is this interventional pain management that you do with injections, is this procedure, can it be done in the office or is it off-site at a hospital or surgery center?
Most of what we do is performed in a procedure suite in our office, but oftentimes patients, for a variety of reasons, require some sedation in order to have the various procedures that we perform done safely and comfortably. So some of it is done in the office and some of it is done in an outpatient surgical center with the patient sedated.
So it's a case-by-case basis, obviously.
Absolutely, case by case.
And now to see you, and I should have mentioned early on, you're Dr. Gary Richmond with the Orthopedic Center of Palm Beach County.
Yes.
Now, if someone wants to see you, they hear a little bit about this driving around, or they hear it on social or see the video on social media. Is it referral based? Is it something you can just walk in, make a call? Is it that easy?
You can be referred by another physician. You can make an appointment on your own, self-referred. We have 3 locations. They are in Boynton Beach, Lake Worth, and Wellington. And we can be reached at one number for all 3 locations, and that's 561-967-6500. And our operators and our staff will get you all set up at whichever office is most convenient for you.
And a big question nowadays also is insurances. What do you take? But you have 16 physicians on staff, so I imagine you have a huge office staff as well, able to answer those questions.
So we've got an entire staff that can answer all of your questions. We don't want anybody to have surprises the day of their visit. So feel free to call. We can make sure that your insurance is one of the plans that we participate in. And as long as we're participating providers, then everything should run smoothly.
And that's Orthopedic Center of Palm Beach County. The number is 561-967-6500. That's 561-967-6500. And online at ocpbc.com. Very easy website. Great website. I was on it a few times this week navigating around, and I was checking out Dr. Richmond, and then before I know it, I'm reading about all the other 16 physicians. I mean, in one place. That's amazing nowadays.
We have every orthopedic subspecialty represented that you could possibly need, including orthopedic spine surgery, pain medicine, physical medicine, and rehab. So if it's anything having to do with musculoskeletal problems, bones, necks, backs, we can take care of it.
And you mentioned there's 3 locations, and you are at, most of the time, 2 out of the 3 locations.
I spend most of my time in the Boynton Beach and Lake Worth offices.
Okay, Boynton Beach and Lake Worth. And then your other offices in
Wellington.
In Wellington, okay. Just jotting that down. That's great. Now let's get a little deeper into the kind of the pain management treatments you do. And do you offer a service or a management for a pain in the neck?
Yes, I do.
I had to.
The Orthopedic Center is primarily an orthopedic practice. So a lot of the patients, most of the patients that I personally take care of, have either neck or back pain. Pain in joints, hands, feet, typically starts out being taken care of by my surgical colleagues, orthopedic surgical colleagues. But in the neck and the back, there are a number of procedures that we do to try and control the pain that comes from herniated discs, arthritis, various injuries from automobile accidents, sports injuries, wear and tear of everyday life. It's amazing how our neck and our back really take a beating throughout life, just in everyday activities.
That was happening to me today. I was driving a few times. It happened. I got that crack in the neck, that weird crack out of nowhere, and I was like, "Wow, what is that?" So, yeah, like you said, over time, it just things happen.
Yeah, that cracking actually is very common. At every level in our spine, on the right and on the left, there are areas called facet joints, and those facet joints are a lot like your knuckles. If you've ever cracked your knuckles, that's the same thing that's happening in your neck when you hear that sound. But that's not the only source of pain in the spine. Not all neck pain and back pain was created equal. So my job is to sort out what the specific source of your particular pain is, identify the source, treat the source specifically. There are different treatments depending on what the source of your pain is, and control it so that we can improve your quality of life.
And how long is a normal, I know it's case-by-case basis, but how long does a normal patient see for duration of time to treat maybe a debilitating pain? Is there a way of saying, or
Gosh,
not really?
In an ideal world, I'd be able to identify the source of your pain, treat it one time, and it would be gone for years, if not forever. But that's not typically the way problems in the neck and back work. Oftentimes, we get to know one another over many months, if not years, because we're not curing anything, and we're also not masking anything with what we do. We're trying to control the source of the pain so that you can go about your daily life with more comfort, but it is likely to come back, and when it comes back, we see the glass half full, not half empty. The bad thing is it came back. The good thing is we've identified how to control it in your particular case, and we just go back, retreat it, and get it back under control.
You've already identified it, and now you're managing it, and it's pain management.
Absolutely.
So it's that easy. Let's talk a little bit about back pain, something that I never really had until recently. I'm going to share a couple of my stories. But I think with being a little heavier with the weight and whatnot, it's become a little more debilitating. Sometimes sleeping at night, maybe turning the wrong way, and it's out. What kinds of treatments can you do for that kind of normal kind of back pain?
Back pain affects. I know very few adults that don't have or haven't had some form of back pain at some point in their adult life. Again, not all back pain comes from the same source in the spine. So is it a herniated disc? Is it spinal stenosis? Is it inflammation of the facet joints? Is it a muscular problem, a bone problem, a nerve problem? We have various ways based on the way you describe your pain, the location of your pain, what some of the diagnostic studies show us when we get them. And then we have a variety of treatments: epidural steroid injections, facet injections, radiofrequency rhizotomies, selective nerve root blocks, spinal cord stimulators, intrathecal pain pumps. There's a lot of different stuff that we have available to us, and the appropriate treatment depends on what the source of your pain is.
Let's hold that thought on. We're going to take a quick break, and on the other side, we'll talk a little bit about joint pain, about your team-centered approach at Orthopedic Center of Palm Beach County, and your background in pain management and anesthesiology on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Ways that you can.
And we're back on Doctors Are People Too. We're here with Dr. Gary Richmond. He's from Orthopedic Center of Palm Beach County. The number's there, 561-967-6500. A great website at ocpbc.com. They have 16 physicians on staff at 3 locations in Boynton Beach, Wellington, and the third...
Lake Worth.
And I'm going to read them out again. But we were just talking a little bit during the break. 2 things I want to mention. The phone number, 561-967-6500, you were telling me that phone number is very well known in Palm Beach County. It's been around how many years?
Orthopedic Center has been around for 65 years, and I'm not certain if that phone number was the practice number all the way back to the beginning, but it's been the phone number for 30 plus years.
Wow, that's great that they haven't changed it. That's awesome.
One number and you can reach us all.
Yep, you can get to 16 physicians. You can talk to the staff if you have any insurance questions, and you treat the full gamut of the human body. Now, I wanted to get another thing we're talking about. I crack my knuckles a lot, and we were talking about joint management. I had to ask you, is it okay if I'm cracking my knuckles? Because I like to crack. I played a lot of football. I like to crack the fingers that I broke, to be honest with you.
Well, when you crack your knuckles, there's just a little gas that's escaping from those joints, and I mentioned that earlier with the neck. That's the same process that's taking place. You're not hurting yourself necessarily, but if you do it and it causes you pain, try not to do it.
Yeah, you don't want to do it over if it's causing pain.
I do it as well.
Okay, I just always wanted to ask that question, so thank you for answering that. And let's talk about other parts of the body that crack joints. I crack my shoulders a little bit. I don't know if I'm cracking it, but I can move them around. And what kind of types of pain management do you offer for joints, and what are the joints? Is it shoulder? Can it be fingers?
Sure. So most of the joints, look, there are multiple joints in our hand and wrist, multiple joints in our foot and ankle. The large joints typically are the knees, hips, and shoulders, and they have their fair share of wear and tear over time, whether it's from injuries or just everyday wear and tear. So sometimes it's a torn meniscus in the knee, or a torn labrum, or a rotator cuff tear in the shoulder. These are things that in some cases are treated surgically. In others, they're treated to take down inflammation with physical therapy, steroid injections within the shoulders. We're now in an era where we use PRP, which is derived from your own serum in your blood that we inject into the joint to try to promote healing. Stem cells that we can harvest from fat, from peripheral blood, and inject into the joints. And we're in the infancy stage of a whole new era of biologic type treatments like that.
Wow, and I've read about a lot lately, so I'm with you on that. I mean, medicine is moving so fast over the last few years. Is this the culmination of research that was done years ago, and then there's so much research that was done just kind of piled up, or is it because of the way technology's moving? And
it's a combination of both of all of that, and some of it is technology that is now finding new applications. But it's a combination of all that.
And let's go back a second to the pain management. Now, these are things you were saying before that you can do in the office and then also at surgery centers. And I wanted to ask you, with Orthopedic Center of Palm Beach County, you guys have a new surgery center on the horizon you can share with us?
We do. We have a new office that is opening within the next month, a little after Thanksgiving, on Hagen Ranch Road, just south of Boynton Beach Boulevard, where we'll be moving our Boynton Beach office to that facility, and the first floor will be an orthopedic-specific outpatient surgical center that all of our physicians will be performing procedures in.
Okay, so not too far from 95, close to the Turnpike right there in Boynton Beach.
Just east of the Turnpike off of Boynton Beach Boulevard on Hagen Ranch Road.
Wow, that is a great area, great growing area, great location. That's great to hear. And so you'll be able to have do the pain management at that surgery center in the office as well.
We're doing a variety of shoulder, foot, hand, knee surgeries. We will be doing some basic joint replacements and some spine surgery there. This is a cutting-edge facility that we're opening.
Nice, and that's great to hear. Now, can you also share a little bit about your experience with anesthesiology? Because when I went onto the website, I saw pain management anesthesiology, and I wanted to ask you a little bit about that. And you have an education and training background in anesthesiology, internal medicine, and also pediatrics.
Before going into anesthesia, I completed combined internal medicine and pediatrics residency, and then for a variety of reasons went on to do an anesthesiology residency, a pediatric anesthesia fellowship, and then the pain management grew out of that as I was practicing. And the reason that it went that way is that in anesthesiology, we are trained to do a variety of nerve blocks to treat pain during surgical procedures and post-operative pain. And there was this huge void that needed to be filled for patients with chronic pain that could benefit from a variety of injections. And anesthesiologists are especially well trained in, I say, putting needles in places they were never meant to be. But we do these injections, we do these nerve blocks, and they have an application in chronic pain management, and the field has grown tremendously.
And then you also studied internal medicine because that is the normal.
Well, yeah, I did that. That's kind of I'm an unusual character in that I did a full residency in both anesthesia, in both internal medicine and pediatrics, completed them, was looking for something different. I wasn't quite settled in my life yet, and turned to anesthesiology, and that's where I've been since.
Now, and you're still board certified in anesthesiology and
Yes.
pain management today. That's
Yes.
important to know. Where did you go to medical school, residency, and internship?
Well, I'm born and raised in Buffalo. I ended up back in Buffalo for medical school. I did the combined internal medicine and pediatrics residency in Buffalo, and then did my anesthesia training at Thomas Jefferson University Hospital in Philadelphia, and a year of pediatric anesthesia fellowship at St. Christopher's Children's Hospital in Philadelphia as well.
Wow.
Then I came down
Great.
here in '95, and I've been in South Florida since.
What brought you down to South Florida?
I was recruited to come down here as a pediatric cardiac anesthesiologist to start the pediatric open heart program at Joe DiMaggio Children's Hospital in Hollywood.
Okay.
I don't think you have enough airtime for me to get from there to being a full-time pain
No,
doc
yeah, that was
in Palm Beach County.
1995.
Yes.
And we're in 2016.
Yes.
That's okay. Well, let me ask this. Why did you initially become a doctor in the first place?
That's a good question.
Yeah.
I think ever since I was a young kid, maybe, I don't know, I'll blame it on my grandmother, may she rest in peace. I don't know. They say, be a doctor, it's a good thing to do. I can't say any one reason. It's something I was drawn to, and certainly my parents and grandparents encouraged me to head down that path, and I'm glad I did.
So obviously you were great in academics to get this far, but also in sports as well. You played lacrosse and hockey growing up?
I've played hockey for many years growing up, and as an adult as well. And the lacrosse part is two of my kids play lacrosse. They play varsity lacrosse at Atlantic High School. So now I live vicariously through them.
So is that kind of your hobbies and passions in life right now when you're not practicing medicine? Is
Spend as
the
much
world
time with my kids as I can. We only have them under our roof for a short period of time, so get very involved with my kids, my wife, and try to exercise as much as I can, and would like a little bit more time to play golf, but it doesn't happen all that often.
Do you have a favorite track in Palm Beach County for golf? I call it track course.
Favorite
place?
course? My favorite course is the one that someone else is paying the
Yeah,
paying
that's
the
always
fee for.
that's always the best.
I don't play that often to
No.
really. Yeah.
Okay. Yeah, I used to play a lot, and I actually grew up. I go into the PGA golf school. I told you before I'm from Jupiter, so when I was 12 and 13, I actually went to the PGA golf school in the summers, and you got to play all 5 PGA
Oh, that's
courses. But I really haven't played much since, so I'm trying to get out there as well.
I'll get to it again one of these days, but not yet.
Let's go kind of circle back to anesthesiology. Do you practice anesthesiology today? Is that something that
I do. I still keep my hands in anesthesia. A couple days a month. I'm still practicing at the Boynton Beach Ambulatory Surgical Center in Boynton Beach, and I just like to keep my hands in it.
Okay. Well, that's why I asked. That's good to know.
Yeah.
That because you seem to have you're very well rounded. I think's the word in medicine. There, you've seemed to study it all.
I've enjoyed my career.
That's great. So we're here with Dr. Gary Richmond. I want to give out his information a few more times before we wrap it up here. Board certified in pain medicine, anesthesiology, orthopedic center of Palm Beach County. It's actually, the number is 561-967-6500. Great website at ocpbc.com. Specialized in interventional pain management. We talked a little bit about that before,
Yes.
but also in joint pain management, neck pain, back pain, and you work with 16 different physicians. You're one of 16 physicians at Orthopedic Center of Palm
Yes.
Beach County. Let's talk a little bit about that. So that's a very team-centered approach.
We are a true group practice. We have it's really a university type mentality that we have at the Orthopedic Center. We have hand and upper extremity orthopedic specialists, foot and ankle, sports medicine, pain management, pediatric orthopedic subspecialists, general orthopedists, orthopedic spine surgery, physical medicine and rehab. And all of us have our piece of the pie that we are responsible for and experts in. So oftentimes we will end up working together to give our patient the best care that they need depending on what their underlying problems are.
And that's great to know. Right here in Palm Beach County's Orthopedic Center of Palm Beach County, 561-967-6500 and ocpbc.com. Before I let you go, since you're from Buffalo, I got to ask you, are you a Buffalo Bills, Buffalo Sabres fan?
I am a huge Buffalo Bills fan, a huge Buffalo Sabres fan, and because of that, I know how to suffer in silence.
Well, yeah, we went through that a little bit down here with the Dolphins lately, but seemed to turn it on the last few weeks.
Where did this come from?
Happened. Yeah. Actually, a lot of people said, you're wearing the Dolphins aqua today, and I didn't even know, but... Yeah,
you just did that to rub my face in the fact that the Dolphins are playing better than the Bills right now.
Yeah, because you guys normally beat us twice a year the last few years, I think. It's happened a few times. That was always the toughest game to go to growing up, was the Buffalo game. Because I like Buffalo a lot because I grew up going to the games when Marv Levy was coach and Jim Kelly and Thurman Thomas. So actually I really pulled for them.
They were an awesome team. They had a great run.
They were really, really good. And Bruce big
Smith.
defensive lineman, Bruce Smith. Thank you for the help with that.
Yes.
But I just want to thank you again for coming on the show, and definitely come on again. I know we didn't get through all the questions that I had.
Happy to come on anytime.
Thank you. It's Dr. Gary Richmond, Orthopedic Center of Palm Beach County. The number's 561-967-6500, and the website is ocpbc.com. Thank you for coming on Doctors Are People Too.
Thank you for having me.
Awesome.
Dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm gonna stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking, and all of a sudden I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red wine, that light red wine. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I want to live. I think that God gave me one more chance in life, and I had to take advantage of this.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And welcome back to Doctors Are People Too, live here on iHeartRadio and WWNN 1470 AM, and now on 95.3 FM, sounding great. I listened to it today on my drive up, really clear. And then also on WWNNradio.com. You can always call into the show at 1-888-565-1470. I'm really excited because we have Dr. Carlos Sanchez on the line. He's Medical Director of Emergency Services at North Shore Medical Center. And I don't think we've had an emergency services medical director on the program. That would be pretty rare for us to find in the first place. But even an emergency room doctor on the program, we've been doing this since May. So, Dr. Carlos Sanchez, how are you tonight?
I am doing great, David. Thank you for having me on the show.
And thanks for coming on Doctors Are People Too and taking the time out to tell us a little bit about what goes on in the emergency room on a day-to-day basis, and also the growth in emergency services that we've seen here in South Florida. So let me get right to it. What is a regular day in the life of the job of a medical director of emergency services? That's a little different than just a emergency room physician.
Well, sure, yes. A medical director, I can tell you, is a little more predictable than in the emergency physician shift. As a medical director, obviously, I go to many meetings. I sometimes serve as an educator, a coach for the team, a liaison between the nurses, the hospital, and the physician group, all to try to, to provide a state-of-the-art medicine to our patients. So there's so many policies and procedures that changed over the years, and of course the medical part of technology that has grown. So my job is really to be a leader and try to disseminate this information to the group, make them comfortable with it, and if they have any problems, coach them through it. Quite different. It's a little more predictable than when I do a regular shift, because I am a clinician. I still work many shifts a month. And that is obviously very unpredictable. That's every day is a little different. Every day is a little different, and you got to be prepared for whatever walks in that door.
So, as medical director, you're the expert on policies and procedures, and the leader of the team. So, when you're in that role in the emergency room, you're in a director role, but you're actually right there in the emergency room, overseeing everything. And then also, like you said, you go to meetings with the hospital staff and A-team. Am I right about saying that?
Yes, that's correct. A good leader has to be in the front line as well. You can't just be behind the scenes and going to meetings and not being there seeing patients and seeing what works and what doesn't. But in order to learn more and see what the hospital needs are, you have to go to meetings. You have to see what the latest sepsis committee, cardiac committee, neuro committee is working on, and how it affects the emergency department and our patients. So, at North Shore, like other medical facilities, we have to work together with team members from administration to nurse educators, and it's really a team effort to work behind the scenes and then bring it out to the front line.
Now, how many years were you an emergency room physician before you became medical director of emergency services?
That's a good question. I moved down to Florida after my residency. I trained over Newark, Beth Israel, and that was in '99. I joined the staff at North Shore in 2000. I joined a group, one of the few private groups in South Florida, and I believe now 5 years later, I took over realm as the medical director, and that's 2005, 2006 or so. So it's been a while. Time flies.
It sure does, but congratulations. You've been there a little while now. That's great.
It is. It's not easy to be, there's a lot of movement in medicine in general, and emergency medicine is no exception. But, I've always had an attraction to North Shore. I've had family members that have been treated there, and always pleased with the service. And there's something about North Shore that is friendly, yet very professional. So it's not a kind of hospital where people are walking on eggshells and there's all these tension. We like to feel, happy, relaxed, but also get the job done. And that's, I think that stems really from the culture of the administration we have there, from the people that lead the hospital. It trickles down to providers and ultimately to great patient care.
We're here with Dr. Carlos Sanchez. He's Medical Director of Emergency Services at North Shore Medical Center in Miami. Great website, northshoremedical.com. And the number is 305-835-6000. That's 305-835-6000. And it's located just west of I-95. I've been there a few times off of Northwest 95th Street. I'm going to read the address here in a second. But I want to say it's only a little half a mile or so west of the interstate. Dr. Sanchez, let me ask you a question I've always had. I've been in emergency rooms a few times, but I think sometimes we think of the TV show ER, and we have a emergency services director here on Doctors Are People too. So I wanted to ask you a little bit, take us through the emergency room. How many beds does the emergency services unit at North Shore Medical Center have?
Well, North Shore currently has 30 fully monitored beds. We have an area that we call Fast Track, which is 4 beds. We have a medical screening room with 2 recliners, 2 quick beds there. So, it's grown over the years. We've made adjustments. We've renovated the ER. So it's grown to meet our patient demands, although I can tell you, even with that growth, we still sometimes find ourselves stretched. Somehow patients, they love coming to the ER. We do get busy.
Yeah.
That's part of the job. And so we have approximately, you could say, 38 or so beds that we use regularly.
Wow, that's a lot, and that is a busy emergency room, and it's North Shore Medical Center. It's 1100 Northwest 95th Street in Miami. The number is 305-835-6000, and it's just west of I-95, the Northwest 95th Street exit from either the northbound or southbound I-95. Dr.
It's pretty easy to get to. We have a lot of people that actually work in Broward. Some on the beach. It's easier because it's so close to the exit 95 there on the highway.
We were talking about how many beds at North Shore Medical Center. Volume, it continues to grow. Is that correct? Even though there's been a growth of urgent care business, across South Florida, you were just saying it's still a very busy ER. Yeah,
that's correct, Dave. We grow every year about 3 to 4% in volume. We're approaching 59,000. So every year we see steady growth. I think urgent care has affected some hospital volume. Of course, the lower acuity volume that hospitals see, but I think mostly in the suburban areas. In our area where we're sort of mixed between city, suburban. We have a mixed population. Sometimes, there may not be as much resources for some of these patients to go to, such as clinics and even the physician's offices may be always full. But so they end up going to the ER. So a lot of that population that has been affected by urgent care centers tend to gravitate more towards the really rural or suburban areas. More of the city hospitals still see quite a volume, whether it's high acuity and low acuity mixed.
And now the cases that you're seeing, can you share with us? Is there a way to tell us when and at what time is the emergency room busiest throughout a 24-hour period?
In general, that is kind of predictable with the data that we have now with the electronic medical records. We can determine trends and when patients come in. So we start seeing an upswing as early as 9 in the morning. And that continues right up until 10 at night. That's a steady stream of patients trickling in per hour. Now, so we staff accordingly, which is quite good. We know when our patients are coming to go. We know when the lows are. We can staff nursing and doctors accordingly to meet those demands. But as you know, emergencies happen at any time, and there's a lot of unpredictability that occurs in the ER. I mean, I started a shift today at 6 a.m., and I can tell you the first hour, I saw some pretty sick people there in the first hour of work today. So you just really never know. You've got to be prepared at all times for a rush of patients and some very sick at times.
And today's actually a Monday right after a weekend, so and you said you were pretty busy at 6 a.m., so can a day of the week, like a Monday, can be pretty busier than, say...
Yeah, especially after a supermoon.
Oh, wow.
So,
yeah, that's a good point.
Yeah, Mondays tend to have a reputation of being one of the busiest days of the week, Mondays and Tuesdays. And I think it's because people on weekends sometimes are just too busy watching the football games and enjoying the family, and really, they'll put off illness and getting checked until the last minute, and that's why we see that kind of rush on Mondays and sometimes even Tuesdays.
Well,
and that's been pretty consistent.
Yeah, and that supermoon was huge last night, and I know it was messing with the tides, so yeah, that's a good point.
I felt it this morning.
we hear that from time to time, but we heard it here first from an emergency room physician. I want to ask you, you mentioned fast track service briefly before. Can you explain it for the listeners? North Shore Medical Center offers it in the emergency room, and it's called fast track service.
So fast track service is it's an area in the ER. It's a service and an area that's geared towards minor emergencies. So if someone would come in, let's say with a laceration or a sprained ankle, we try to have a separate area for these patients that they can be seen in a timely manner, not get mixed up with the heart attacks and the strokes, and get caught up in some lengthy workups. So these patients, the intent is to get them in, diagnose them, treat them, and get them where they need to be sooner. And we have a dedicated staff to do this. We typically have a nurse practitioner, a PA, a nurse, a paramedic, and then the doctors are obviously very nearby to discuss any cases. So, with these 4 beds that we have, and we're open, fast track is usually open 12 hours a day. We get to see a good 35 patients easy through this room, and they're typically quite happy that they're seen sooner.
That's a great program. And we're here with Dr. Carlos Sanchez, Medical Director of Emergency Services at North Shore Medical Center in Miami. NorthShoreMedical.com is the website. Number's 305-835-6000. And North Shore Medical Center is located at 1100 Northwest 95th Street, right in Miami. Easy exit off of I-95. Dr. Sanchez, I want to ask you on the other side of a commercial break here a little bit about emergency room slowest, when the emergency room is slowest, because I didn't get to ask you that, and kind of the common injuries or ailments you see in the emergency room. So hang right on, and we'll be back on Doctors Are People Too.
Sure thing.
I wasn't feeling right. I think I was running a high fever.
He couldn't breathe.
I was circling the drain.
I told Dr. Lieberman, I'll take him anywhere I can get him. Let's just not let him go. Dr. Lieberman fought as hard as I did. And the both of us literally each had an ankle and pulled him out of the drain.
They literally saved my life. My wife and Dr. Lieberman.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Shands, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum, in that involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. Also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Sanchez, Medical Director of Emergency Services at North Shore Medical Center in Miami. The website is northshoremedical.com, and the number is 305-835-6000. North Shore Medical Center is located at 1100 Northwest 95th Street in Miami, right off of I-95, easy exit, right off the interstate. Dr. Sanchez, we were talking about the busiest time in the ER and the fast track service that North Shore Medical Center offers. When is the emergency room slowest?
Well, sometimes never, but people do sleep, and I guess if you overnight, at a certain point overnight, usually after 2 a.m. to 6 and 7 a.m., you're going to have a little drop in volume. However, usually with that drop in volume comes a higher acuity or sicker patients coming in. So these are patients that don't necessarily walk to the hospital or have minor ailments. These are the times when people have trauma, may have strokes and heart attacks. And so you may have less patients, but they're often sicker.
Now, I wanted to ask you, is there a most common injury or ailment? I know you treat everything. You see everything on a day-to-day, week-to-week, month-to-month basis. But is there a common injury you say or ailment you see in the ER?
Typically, shortness of breath is very common. Change, whether it's from flu-related problems, colds, cough, and bronchitis. We see a lot of different gamut of shortness of breath. From congestive heart failure. So that's something that is very common, along with chest pains and trying to differentiate, what's a true, dangerous chest pain from one that's benign, like a musculoskeletal injury. But those are quite common, as well as orthopedic injuries that we see. Musculoskeletal injuries are pretty common. So always chest pain, shortness of breath. Abdominal pains are quite common too. You have to, again, figure out if it's a minor gastroenteritis or do you have appendicitis or something even worse. But those ailments are quite common. And of course, when we approach this time of year, the flu starts spreading, and you do see a wave of flu patients. And that increases the volume also of the emergency room.
Definitely, and you've been on the clock since 6 a.m. this morning. It's almost 8 p.m. tonight, and you've been at North Shore Medical Center for 15 years, if I'm correct. What keeps you coming back to the hospital for more?
I actually a little longer. I think it's closer. Yeah, 15, 16, 17 years. So like I said earlier, North Shore is a special place for me in my heart. I when I first moved here, it was my first job. I really worked with a very good group of doctors who have now moved on, but we had a strong group for a few years, and I took over, and we've had other teams come in and help the ER. My father passed away at North Shore for natural medical reasons, and I was impressed by the care he got there at that time, and that was when I first started. So it's been a journey, and I keep coming back. I find the people friendly, supportive. We have again a very supportive administrative team there that really knows the ER, cares about the ER, and cares about the delivery of care that we give our patients, and that's what makes it work. And I haven't really looked farther than North Shore to work.
Now, also, when you're not providing medicine and treatments, what are your hobbies and passions in life?
Good question. I do need more hobbies. I'll be the first to admit that. But if you notice the emergency room, emergency rooms in general, there's no windows. So,
that's right.
Right, no windows. After a 10 and 12-hour shift, you want fresh air. And, I take advantage of my backyard, which is Biscayne Bay, and the home, South Florida, close to the water, and bike riding, the beach and boating, and just, being outdoors is the relief, the natural prescription, sort of say, that we need working in the ER. That being said, my wife and I do like to take trips frequently. So, we can do some short getaways, and living in Miami, there's a lot of short getaways you can take, either going to the mountains or going to the Caribbean. And then we plan our big trips every year. So you got to balance your work. There's no doubt about it. And my balance is just to clear the mind a little bit by getting outdoors.
And then also, I know we talked briefly on the phone earlier today about continuing education, and you just attended a convention in Las Vegas, of all places, a medical convention. Can you share with us a little bit about what went on out there?
Sure. Briefly, interestingly enough, it's a age management convention, and it's in Las Vegas. But again, it's all about balance. But it was very interesting, and a lot of intelligent doctors from around the world really talking on preventive medicine, optimizing health, which I think in general, we may not do enough as physicians in this country in general. I think sometimes we treat illness, and we sometimes even maintain it without thinking, beyond the obvious, and we have to do more with prevention, and that starts with talking to your patients, educating them on lifestyle, telling them some of the state-of-the-art nutritional guidelines, and meditation. And there's so many things that we can do outside of prescribing a pill that can really increase the longevity and the quality of life. And that's what this is about. So it's very different than what I do in the ER, but I do incorporate some of this in that practice, and I think every physician should. So it was very, very interesting conference, and I usually go to one of these once every couple years.
And we're here with Dr. Carlos Sanchez, Medical Director of Emergency Services, North Shore Medical Center in Miami. The website's northshoremedical.com. Type that in the browser. 305-835-6000 is the number, and they're located at 1100 Northwest 95th Street in Miami, just off of Interstate I-95. Dr. Sanchez, I wanted to ask you also a little bit about, we think of you as always in the emergency room, but you have a whole nother life outside of it. You're involved with Medistation and urgent care on I'm seeing it as Coral Gables and Miami Shores. I haven't been there yet, but it's in Miami and Miami Shores. Can you tell us a little bit about the MediStation Urgent Care?
Sure, that's correct. If I didn't have enough work in my hand, in my entrepreneurship, in 2009, I opened a urgent care center in Miami Shores. It's called MediStation Urgent Care. The first one in that area, and so we serve the community. We serve the community for needs that they need. It's a walk-in center. For less acute medical conditions. Sometimes we do see people that come in that require further intervention, and my staff and the providers are all trained to identify when a patient needs to go to the hospital when we have our limitations. But for the most part, it's a nice business. Patients love it. They love going to a nice-looking facility where they can be treated timely and get back to work or get back to their families. And so I opened another center this year in Coral Gables, and I keep my wife busy. She's the office manager of both of them. So,
well,
it's all teamwork, and it's all working out well, and quite happy.
Well, thanks for coming on Doctors Are People Too. We'll have to have you on in the future. Thank you, Dr. Sanchez.
Thank you, David. It was a pleasure. Thank you very much.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Talk 1470 is WWNN Pompano Beach and